Well, critical healthcare situations are unfolding across the country. Health P.E.I. has just announced a reduction in epidural services for pregnant patients at one hospital. It's due to a lack of staff. For the next week, epidural pain relief may not be available to patients in labor between 8 a.m. and 3 p.m. if the lone anesthesiologist on duty is in the operating room. So for more on this, we're joined now by Dr. Trevor Jain. He is the director of UPEI's paramedicine program and an ER doctor at the Queen Elizabeth Hospital in Charlottetown. Dr. Jain, thank you so much for joining us.
Thanks for having me, Arthi.
So first, I want to ask you your reaction to this.
Yeah, I mean, it's concerning for sure. I mean, we see it across the nation, emergency departments closing due to lack of staff. We know that the medical assistance chain is being affected by that. And we only have 4 hospitals on Prince Edward Island. So when we lose a service like that at Prince County Hospital due to staffing issues or COVID-related outbreaks, it can significantly impact the rest of the system and most importantly, the anxiety and care of some patients.
So then, Dr. Jain, with this new sort of rule in place, and again, it's a temporary sort of workaround right now up till September 2nd that's been announced, what are patients who are expecting, who could go into labor, as you know, it's unpredictable, who could go into labor during that window of time, 8 a.m. to 3 p.m., what are they supposed to do if they had intended on using an epidural for pain relief?
Yeah, it's a great question. I do not speak for the health authority. I do not speak for Health Prince Edward for Health PEI, but as a frontline emerge doc, I mean your only real option is if you're in a significant amount of pain and in crisis is to call 911. We're lucky that we have some talented folks at the Queen Elizabeth Hospital. We do have a full obstetric service and a neonatologist. So there is care available, but unfortunately it's centralized in the middle of the island due to the staffing shortages that we've been suffering.
So could that leave then some expectant parents, some expectant mothers in a situation where they may not be able to get an epidural for pain relief?
You know, it's a great question, Arthi, and it's like looking in a crystal ball because each case is so different. I mean, I've already got a call from colleagues and friends yesterday that expressed some anxiety and concern that are coming up for delivery about the fact that they live relatively far away from Charlottetown, and they're concerned about getting there. But what I will say is this: is that we have talented paramedics in our province. We have a talented EMS system, a pre-hospital system that should be able to provide some temporary pain relief should a patient need it. Look, I like to see in our emergency department that all our hospitals staff fully. I treat the staffing shortage, like a bleeding trauma patient. Talk about privatization, recruiting, and foreign trained healthcare providers is excellent. That's adding blood to the patient, but we need to stop the bleed. So anything that we can do to retain nurses, physicians, support staff, that's what I like to see from a national level and a local level.
So on that front then, what do you think are some of the steps that need to be taken by health authorities? You can speak specifically to PEI, as I know it is quite different from some of the other jurisdictions across the country, partially because of the population as well. What do you think can be done?
I think we need to do 3 things from a national perspective. We need to support our primary care physicians. I'm not saying that every problem in Canada needs to be seen by a family doctor, but every Canadian should have access to a family doctor. I was really impressed with British Columbia in their financial aid package that they're providing physicians that are paying their own overhead, are getting bogged down in paperwork, electronic medical records. So that's a real good step to stop that bleed. Let's stop the bleed and help retain our primary healthcare providers and our family physicians. The second thing I would do is let's get together and work on long-term care. These are patients, not victims. So a lot of people look at long-term care patients in the hospital as a problem. These are elderly Canadians that need care, and they shouldn't be warehoused. We saw how horrific some of our nursing homes across the nation were when COVID happened, the stories that came out of the military when they went in, it was horrific. So support long-term care, provide a nice environment for our elderly to enjoy and thrive and live their years in. And then the third thing I would do is mental health. We need to really concentrate on mental health on Canadians. And I think if we start there acutely, I think we could have a robust system.
Dr. Jane, we appreciate your time on talking about this topic. Thank you.
Thank you so much, Earthy, and thanks for having me.
Dr. Trevor Jane is the director of UPEI's paramedicine program and an ER doctor at the Queen Elizabeth Hospital in Charlottetown.